The penile implant can really be a good procedure for most patients. As I've said, my approach to patient care for any treatment for erectile dysfunction is a shared decision between myself and you as the patient. There are exceptions to that. There are some anatomical exceptions and some comorbidity or other disease exceptions where penile implant may not be best for you as a patient. But I've done these on a range of ages of patients from 30 to 85. There are patients that have other medical comorbidities or other medical issues that still get these implants. So typically it's patients who are still functional from a daily activity standpoint and are interested in having erections that are spontaneous and ongoing. And we can have a shared decision-making process about getting a penile implant. But if you're thinking that you're not a candidate, it would still be worth coming in to talk about it and potentially exploring the options, because there is a wide range of patients who are eligible and able to get this procedure. Insurances typically do cover this procedure, including Medicare. We would always check prior to your procedure to make sure that your insurance does cover it so that you do not get a surprise bill. But the majority of patients who sign up for this procedure have insurance coverage without any issue. The penile implant device has kind of improved over the last 40 years since it was developed. There are two main companies that do penile implant manufacturing. One is Coloplast and the other is Boston Scientific. Both are what are called three-piece devices mainly, which have a reservoir which sits up behind the muscle, a pump that goes in the scrotum, and then the two penile cylinders that go in the penis for inflation. Those are the inflatable penile prostheses that probably 90% of the patients, 95% of the patients that I do these on get. The other option is called a malleable implant, which doesn't have a pump or a reservoir and is just bent into position to use for erections. That's typically used for patients who don't have as good of hand dexterity or have some issue with pumping up the device. In general, the inflatable device is a better option, and the two companies are really the main ones that are used in most medical centers throughout the country. The implants are sized intraoperatively or during your procedure. I will show you on your preoperative exam by putting your penis on stretch how much length I would expect you to have. But when we're in the operating room, we really do a very thorough sizing to make sure that the size of implant that's put in is right for you. Unfortunately, I can't add any length to what you have, and typically guys notice that their penis is a little bit shorter after the procedure than it was when they were 20 and getting erections. But it's still going to be functional and it's very usable for your sexual encounters. But I make sure that it's sized appropriately to you during surgery. There is some added girth or width to the penis, especially with the Coloplast devices. And so that is always something that guys can expect. But the length is during the procedure, and I try and show you as best I can what that would be for an expectation prior to surgery. The IPP is a pretty fascinating device. If you really look at it, it has a lot of very small valves and pumps in it that allow the fluid from the reservoir that's up behind the muscle to get pushed into the cylinders that are in the penis. It takes somewhere between 6 and 12 pumps of that pump that's in the scrotum to get the device fully inflated. It is a little bit like a baseball glove. It takes some time to get used to, it takes some breaking in, but once you've come into clinic to get some teaching from me and use it at home, it's typically very straightforward for patients to use. A few pumps will get that fluid in, and then there is a button or a bar on the top of the pump that you can press that will decompress the cylinders, and it often takes a little bit of gentle squeezing of the penis as well to get that fluid out. I teach you how to cycle, which is what it means to inflate and deflate the device in clinic, and make sure you're comfortable with that before you go home on our follow-up visit. The nice thing about the penile implant is that it really doesn't change the sexual encounter after the surgery. The sensation of the head, shaft of the penis, and the scrotum is the exact same. I'm not cutting any of the nerves that go there. Likewise, the ejaculation experience is the exact same. Some patients who have comorbidities that may affect their ejaculation may not ejaculate after the surgery, but that would be something we would discuss ahead of time. Otherwise, your sensation, ability to orgasm, and ability to ejaculate is the exact same. All of the pieces of the implant that I put in are underneath the skin. The pump that's in the scrotum is almost like a third testicle in that it's in the front, but it's quite inconspicuous in that you can't see it when you just pull your pants down. The reservoir similarly is behind the muscle in the abdomen, and you can't see that. And the two cylinders that are in your penis look like a normal penis when it's placed. There is some increased length at baseline with the implant. That's just part of having the implant in. But guys are able to wear their normal clothes, their normal underwear, their normal pants without any issue. The implant is made of silicone, and it has a coating on it called Bioflex that allows me to tailor antibiotics to the procedure that I'm doing. This is not something that your body recognizes as foreign. It's not going to reject it. It's not going to set off metal detectors when you're going through the airport. It's a anti-inflammatory device that goes in, and so your body doesn't treat it as anything else other than your normal tissue. The implant is filled with injectable saline. Saline is a saltwater solution that's sterile. The fluid goes into the implant without any air to allow you to have an easy experience with pumping the fluid from the reservoir to the cylinders. That fluid doesn't get out of the cylinders or the reservoir. They are fully puncture-free, and so that fluid isn't going to cause any infections or any issues going forward. The IPP procedure takes about 90 minutes. You are asleep for the procedure the way that I do it. You go home the same day. I make a very small incision in the scrotum, just below where the penis meets the scrotum, and I place all of the elements through that incision if I am able to. Depending on if you've had prior surgeries or some altering of the anatomy, I may have to make a small incision on the lower abdomen. But typically I can do all of the implant through that penoscrotal incision, or that incision on the scrotum. I'm placing the cylinders directly into the penis to replace the erectile tissue. So after this goes in, you can have some semblance of engorgement of the penis, but you will not get erections on your own. These cylinders replace that and allow you to have a nice firm erection. The pump is placed really underneath the skin in the muscle layer of the scrotum. That allows you to easily grasp and pump it up. And after all of that is done, we close everything up with dissolvable sutures, so you don't have any sutures that have to be removed. The swelling after the surgery can happen for about 2 to 3 weeks, but it's not debilitating. You're able to move around and do your daily activities. And then I have you come back about 3 or 4 weeks after the procedure to learn how to pump and use the device. On average, patients have about 2 to 3 weeks where they have some swelling, some discomfort, and are not able to use the device. I have patients come back to see me somewhere between 3 and 4 weeks after. I make sure that everything looks in order and as it should be as a healing process. And then I teach you to pump up and deflate the device. And then I want you to do that for about a week at home before you start using it. So on average, you're sore and swollen for about a week or two, swollen for 3 to 4 before you come back and see me. And then you're able to use the device somewhere between 4 and 6 weeks, depending on your recovery. I usually want patients to wait somewhere between 3 and 6 weeks to start using their device after surgery. Some patients heal a little bit quicker than others. Depending on how complex your surgery is, you may need to wait a little bit longer. But I usually have patients come back at 3 to 4 weeks to learn how to pump it up. They take a week or so to get used to that on their own and then can start using it once all of the stitches dissolve. On average, penile implants last somewhere between 10 and 15 years. The data would show that the device that I use, primarily a Coloplast device, lasts somewhere between 15 and 17 years on average. Now, it's like a car. The more you use it, the more breakdown it'll have, the more wear and tear it'll have. Your device may last a little bit less time, but they are replaceable. It's relatively easy to replace. And so if you get to the point where your device needs to be replaced, that is something that we offer. But on average, guys usually have one device placed and they get through the rest of their life with that device in place. Not surprisingly, the IPP has a very high satisfaction rate. On the studies that have been done specifically with Coloplast devices, it's somewhere around the 95 to 97% range. The reasons that guys are frustrated with their devices afterwards is they have trouble maneuvering the pump, they are concerned with the length after surgery, and they may have some changes in terms of their orgasm ejaculation that they didn't notice before surgery. A lot of this for me is counseling, so we'll go over those risks at the beginning before we do the procedure. I will let you know exactly how long I would expect your penis to be after we put it in on exam, and I work with you to work with the pump. So in general, for patients that I see, we have a very, very high satisfaction rate, and I think a lot of that has to do with the counseling and the discussion that we have prior to surgery. The penile implant surgery is relatively low risk. There is not a large incision in the scrotum. The bleeding and infection rate is quite low, less than 1% for most patients. If you have diabetes, it can be a little bit higher. It is a bit devastating if the device gets infected because it has to come out relatively urgently, but it can be replaced somewhere between 3 and 6 months after. Again, that rate of infection is very low, and we do things during surgery to try to minimize that infection as much as we can. Other risks: swelling, pain, breakdown of the device are relatively rare issues, and as we talked about, the breakdown of the device usually happens somewhere between 10 and 15 years after. So guys really like this because they put a lot in up front in terms of a 2 to 3 week recovery, but there aren't a lot of risks to it going forward, and so they get to use the device relatively quickly and for a long period of time.